It is scary, like to have your surgery on your eyes. You have to be awake the whole surgery. You have to focus on one point to see what if I move during surgery, what if I look other way, like will I go blind because of that stuff, you know. My name is Irina and I'm a mentor at Docfinderkorea and I've been working here like for 6 years already. Today we will talk about my surgery. My eyesight has been getting worse since I came to Korea in 2012. As soon as I step into Korean land, my eyesight started getting worse and worse. Little by little, it gets worse and worse, like year by year. If I wear contact lenses for 3 to 5 hours, I feel like my eyes are very dry even though I use the eye drop. If I don't remove contact lenses, I sometimes have headaches. I don't want to wear contact lenses anymore. So I'm very excited. I will get rid of those glasses. I will get rid of contact lenses and finally I will be free. For me, sight is the most important of the senses. Like I cannot imagine myself without being able to see stuff. It is scary, like you have to be awake, you have to focus on one point to see. You have like thoughts like what if I move during surgery, what if I look other way, like will I go blind because of that stuff, you know. But I don't know what will I see during the surgery, like will it be painful. Everything together makes me very nervous. That's what kept me away from the surgery even though I wanted to have it for a long time. So today I'm going to the clinic, to Joeunnun Vision Clinic, and we'll be checking my eyes again because I think my eyes changed from last year. I think they get worse, so we're gonna check them again, and I think this time I'm going finally to proceed with surgery. I'm very nervous and scary because it's the eyes. Like I don't care about other surgeries, but vision surgery is the most scary for me. But I know for sure everything's gonna be alright. So let's go and check how my vision changed since last year and see what procedure doctor will recommend me. She's so ready. Yeah, I'm ready. Last time, I don't remember which eye, but one eye was like 325 and another one was like 35. But now you can see my left eye is like minus 425, so it gets much worse than the left. It's interesting because last time the difference wasn't that big. Is it correct? I hope it's correct.
실크라고 하는 거는 이제 스마일이 업그레이드 된 거예요. 스마일을 사람들이 많이 하는 이유는 시력이 잘 안 바뀌어, 잘 안 떨어져.
네.
이게 스마일의 장점이고 회복도 빠르고, 수술하고 나서 뭐 2, 3일, 3, 4일 지나면 뭐 눈을 비비건 막 눈을 부딪히건 운동 뭘 하건 상관이 없고, 땀이 들어가건 상관이 없고, 특히 여성분들은 며칠만 지나면 화장 지우는 거 다 오케이. 그러니까 화장하는 것도 다 상관이 없고, 그래서 관리하기도 편하고, 수술한 것 때문에 뭐 눈이 피곤해요, 눈이 건조해요, 이런 거 없습니다. 이제 스마일이 업그레이드 돼서 나온 건데, 요거의 장점은 우리가 눈이랑 기계랑 서로 결합이 돼요. 그래서 레이저가 나가. 근데 안에서 눈이 막 움직일 수가 있어요. 그러면 조금씩 미끄러지면 요것 때문에 수술 결과에 영향이 있거든요. 근데 실크라고 하는 거는 외부에서 눈을 따로 고정을 해요. 그러니까 내가 움직일 수가 없어. 그냥 고정한 상태에서 레이저 나갑니다. 그래서 좀 더 정확하게 되는 것도 있고, 수술은 각막에 우리 렌티큘이라고 해서 렌즈 모양으로 분리를 해서 이거 끄집어내거든요.
네.
이걸 우리 렌티큘이라 그래요. 이 렌티큘이 광학적으로 더 좋아요, 스마일보다. 그게 장점입니다.
왼쪽 눈이 좀 많이 떨어졌는데 이게 문제가 없나요? 예전에는 여기 3.0인가?
지금은 4.
네.
도수가 약간 바뀔 수는 있어요. 왜냐면 살다 보면 근시가 진행하는 거는 보통은 청소년기에만 진행돼요. 그래서 20대 넘어가면 안 바뀌거든요. 근데 전혀 뭐 변화가 없는 게 아니라 조금씩 바뀔 수는 있는데 많지는 않을 거고, 나이를 먹다 보면 우리가 30대 30대 후반, 40대 가다 보면 수정체도 점점 나이를 먹어. 그러면 얘도 도수가 있거든요. 이게 조금씩 바뀌어요. 그것도 영향을 줄 수도 있습니다.
만약에 나중에 제가 또 한 번 교정하고 싶으면 어떤
할 수 있어,
수술
얼마든지.
다른-
근데 스마일을 한 번 더 교정한다 그러면 라식 또는 라섹밖에 안 돼. 스마일로 교정은 불가능해요. 아직까지 없어요, 그런 게.
네네.
검사 받으셨습니다. 네.
감사합니다.
네, 그래요.
So we finish for today, and then we have surgery on April 17th for now, but the day may change. But anyway, see you on surgery day. It's my surgery day. I'm at the clinic. I'm nervous. I was nervous from yesterday, but when I woke up, I feel like butterflies. I'm scared. I am nervous, but it should be fine. Relax you right away because the doctor said your eyesight will be better right away, but everything will be blurry. Yeah, let's see how it's going. I will be finally seeing stuff, and I will be lens free, glasses free, eye dryness free.
What are you gonna do with your glasses?
This one?
Yeah.
Throw them away. What can I do with them?
They can be a memory of your past.
I don't want this memory. So they will start with SMILE LASIK, but they have like special device like suction. If it cannot go inside my eye, they have to switch to like regular SMILE or SMILE Pro. But if like my eye will be moved too much during the surgery, after that there's possibility they will switch to the regular LASIK or LASIK. So yeah, it's kind of scary. Let's hope for the best, and I will be doing silk and will not be drooping to the LASIK because the recovery after that is much longer. I don't want that. Let's hope. Is it?